and limbs. You can also have myelopathies, which basically over time happen due to compression of the spinal cord and nerve roots. Now, I always explain this principle regarding damage to the spinal cord in a very simple way, which I will let you understand first by seeing this image. Are we seeing this image? Now, this image is showing us this, the spinal bones from a side view. So that's why, so we see up top, we're seeing the neck. Let me see if my pointer can show anything here. Bum, bum, bum. We're seeing this now, the red pointer, good. So in your neck, there are 7 bones that are called the cervical bones. From below the neck going down towards the lower back, it's called the thoracic bones, which are 12 thoracic bones. And the bones right here are called the lumbar bones, which are 5 of them. Now this is the side view. That's why whenever someone stands from side view, you can see curves from different sides, all right? So what happens when I fall from height? Example, a tree or a building versus a stool, which I explained a while ago. But within this bony complex, which is the spinal bones or the spinal column, runs a tube filled with fluid that is called a spinal cord. Now, if you consider your spinal cord like a pipe running from up the hill coming down, if you chop a pipe coming from uphill coming down, would there be any water reaching us down here or no water at all? No water at all. If you were to liken the pipe as a tube and you squeeze the tube, will there be any water below the ear where you squeeze or a little bit trickling down? There will be a little bit trickling down. Not none, unless you really squeeze it very, very hard. So the same principle occurs whenever spinal cord injury. If the spinal cord is literally severed, then in so doing, anywhere below that area that is severed is paralyzed. If it is compressed, then it actually becomes weaker. Now, this picture now here shows you what happens. Now, in paraplegics, so the same principle now. So if you have an injury, a damage to the spinal complex in your neck. So the cervical region, there's a fracture, for example, and the spinal cord becomes severed, then you are considered to be paraplegic. Paraplegic. Tetraplegic I meant, right. So tetra meaning all 4. So if you have an injury to your neck, like a severe injury to your neck, and it causes a damage to the spinal cord, then the hands and feet are going to be paralyzed. Why is that so? The nerves that supply your arms, they come through your neck and come over here. If you have an injury in your back and your neck is spared, then that means your legs will be affected. That's when you become paraplegic. Now, if the injury does not cause severe damage to the neck, then all 4 limbs become weak but not totally paralyzed. The same principle happens if you have an injury to the back and the spinal cord is only compressed, then the legs become weak but not totally paralyzed. Now, another acquired one is actually due to stroke. How many of us know somebody who has had a stroke? You had one. Right. Now, a stroke is a condition in which blood flow to the brain is disrupted, leading to a brain and potentially severe neurological deficits, often caused by, so there are 2 kinds of stroke, simply. Is that you have a stroke that is due to decreased oxygen to the brain, which is called an ischemic stroke, or a bleeding stroke, which is called an hemorrhagic stroke. Now, based on whatever is happening in the brain regarding the stroke, then that determines which side of your body becomes paralyzed. Now, sometimes when persons have a stroke, half of their body goes dead, and the other half is fine, right? Now, if you have a stroke in the right side of your brain, where on your body you think would have become affected? Huh? Somebody said? Somebody said right, somebody said? You said right. Okay, it is not so. So what happens is that, so your brain is in your skull, right? Now, the nerves that descend from your brain along the spinal cord, whenever they are coming down now, something happens in your body that is called decussation. So what happens is that as the nerves come down from your head coming down, the nerves literally cross to the other side. You see that? So that's why if you have a stroke in the right side of your brain, the left side of your body becomes affected. And if it happens in the left side of your brain, right side becomes affected. Make sense now? So Huh? Yes. So now, I know different parts of your brain determine or manages different parts of your body. So your speed center in your brain is actually on which side of your brain, left or right? Anybody? Nobody don't know. Huh? No. So your speed center in your brain is actually in the left side of your brain. So that's why whenever some persons have a stroke, they end up, some persons have a slur in their speech or they can't speak any at all. That's most times it's because it happens in the left side of the brain. All right. So strokes as well can also make someone become paralyzed. Would that be fully paralyzed on the right hand side, which is hemiplegia, or if it's only weakness alone, it's called hemiparesis. They can also be monoplegia or monoparesis, meaning only one limb alone can become paralyzed, which can even be due to some other injuries as well. Right? And this picture also explains, which where you see here on the right brain controls left side of the body, left brain controls right side of the body. All right? So now, as I mentioned before, the title is Disability. It could happen to you in the blink of an eye, and we're looking at a what? A rehabilitative approach. So anyone can become disabled at any point in time. Always remember that. Now, in treating and treatment or rehabilitation of disabilities. So one, there are physical therapies, exercises, which includes electrical stimulation, medical care where we give medications, surgical interventions, because sometimes when some persons have spinal cord injuries or even stroke, if you're laying in the bed for too long, and of course, and you're getting weak or you're already weak, with time, your muscles literally start contracting. So your hands start coming up towards your chest, your feet start curling up. So you have some that are called contractures. And that's one of the reasons why physical therapy after spinal cord injuries or even after stroke is very critical. And time is an important factor. So when someone has a stroke and it is confirmed and they have been treated accordingly regarding medications wise, the next step is to get physical therapy. That's what helps a person to start able to move again or to even get back the chance to walk again. The maximum time in which you should get physical therapy is any time within 1 year after the injury. The longer you wait is the much more difficult it will take for you to get fully rehabilitated. Other treatments are regarding rehab, nutrition, very, very important. Sometimes there are some persons who once they become disabled automatically, disabled due to or paralyzed due to a spinal cord injury, is because there is muscle wasting, not really eating as you should, or in general though, once if you get something that's called a bed sore. How many of us have ever seen a bed sore before? One person. No, basically a bed sore or a pressure ulcer is due to the fact that the person is laying down in the same spot for a very, very long period of time. That's one of the reasons why whenever you sit down on your buttocks, sometimes and you feel like your bottom start burning or whatever, what you do next? You shift, right? Or you stand. Now, when a person who is on the bed all this time, nobody's turning on the person. With time, you end up having bruising of the skin. That is a stage 1 also. Yes? Now, if the skin comes off, that's a stage 2. By the time it goes on into the fatty layers, it's a stage 3. It can go down now into the between fatty layer and muscle. If it goes beyond there, it can even go down to your bone. So I've literally seen persons who have lost both of their buttocks cheeks. So they don't have no bottom any at all due to bed sore. It can be that severe. And in so doing, having proper nutrition, which is high protein diet, will help in wound healing and all of this. So one of the main things that I'm bringing across here, ensure that your relative gets adequate turning at home or wherever they are. Turning should happen often, every 2 hours. Every 2 hours. All right? To prevent bed sore. There's also sex education. Now, there was a study that was done at Surgeon Goling before I got there regarding persons who are paralyzed and their sexual function. Now, persons who have you saying over there, Shakara? No, you be okay. So how many of us think that persons who are paralyzed from the waist down can have sexual function? Raise your hand. You didn't hear the question. Right. How many of us think that persons who are paralyzed from the waist down can have sexual function? Raise your hand. Okay, one person, two persons. All right, I thought I would have had more. All right, so yes, persons who are paralyzed from the waist down can have sexual function. Reason being, it depends on where the injury occurred, because the nerves that supply the genital area, they come off at an area that is called L1, right? So where I showed you the picture where you have the 5 bones there, the lower areas, there are no direct or nerve branches that actually come off fully from there. That's because the spinal cord ends from L1, right? So in so doing, this study literally proved that let's look at our male sexual function, because I guess that's one of the most critical things as opposed to females. Yes or no? Yes? No, because reason why I said that, the male brain, hold on, the male brain is more sexual than the female brain, right? So that is the reason. So because in a male brain, on a list of 1 to 10, sex is number 1, 2, 3. How far do you think sex is on the list of most females, on a list of 1 to 10? Huh? Go again? 5 to 10. Yeah, so you were very surprised that the average female sex on their list, mental list, in the brain is actually 7. Because females don't think a lot about sex. There are some females, of course, who think a lot more about sex. So in so doing now, so educating patients at our facility when it comes down to rehabilitation, we have sex education for them in terms of those who are paralyzed or whatever. And there are different methods in terms of pleasing their partner moving forward from there on. There's also counseling, and there's because you'll be very surprised, many persons can imagine a man who or a woman who was running a massive business, making millions of dollars per week, and she ends up becoming paralyzed. Yes? No, if she's running a business, it would have been different. But if it's a case where this person now was like the breadwinner for their family, and they were working less, but at the same time, they're the ones who are providing for the family, what's going to happen to that family? Suffer. Yes? No, and this now can really affect the patient's mental capacity. And in so doing, counseling is very important, because some persons literally might just say that it's better that they had died in the accident, or better that they didn't make it because no, they're still suffering. Because can you imagine you are fine today and tomorrow morning you can't get up. You can't even sit up to go to the bathroom. Somebody has to change your diaper. Somebody has to feed you. Somebody has to put on your clothes. It's a massive change in your life, literally. And and you see yourself as a burden, and you would prefer to die than to go on. And that's where counseling comes in. There's also a social work involvement, where the social worker literally comes in to let you know what is available for patients who require rehabilitation. Now, where in Jamaica can I get rehabilitation after spinal cord injury or a stroke? Where in Jamaica? The Surgeon Golding Rehabilitation Center. Now, the Surgeon Golding Rehabilitation Center, formerly called Mona Rehab, was established in October 1954 in response to a major polio outbreak in Jamaica. Now, the center, which was founded by Sir John Golding, a British orthopedic surgeon, along with a small team of dedicated health professionals, served as the only public center in Jamaica and the English-speaking Caribbean, and catered for the rehab of patients affected with polio. Now, at present, the Surgeon Golding Rehab is the only public facility in Jamaica and the Caribbean that offers rehabilitation. Only public facility, right? The center caters to rehab of patients with spinal cord injuries due mainly to traumatic or non-traumatic causes, and has a capacity of 68 beds, 28 adults, and 40 pediatric beds, which are kids. And there's also an outpatient department where we have clinics on Tuesdays, and we have an artificial limb clinic, so for prosthetic limbs for persons who have lost a leg or an arm or whatever, We have this clinic on every first Friday of a month, every month. Now, what happens at Surgeon Golding Rehab? What are the services? So we manage patients with congenital illnesses such as cerebral palsy, among others, spinal cord injuries, medical care for spinal cord injuries, physical therapy, where persons come and we see them, and some persons are actually admitted for like an average between 3 months to as much as even 6 months. So persons who come to us are persons who can't walk or can't use their limbs in general. Now, what is the aim of rehabilitation when a patient comes to us? The aim, of course, is for a patient to live as functional as possible based on what their body is capable of doing. Everyone who comes to the facility would want to leave there walking. Yes? But you have to be realistic based on what you have. If you are paralyzed from the neck down, as opposed to partial weakness, then the likelihood of you getting able to sit up is a big change where you can at least use your hands to feed yourself or to even transfer yourself as opposed to not doing anything at all. We've had persons who have come to us and they return to us for reassessment to be able to start driving again for their companies. So we have seen great results in patients. Now, the patient presents to the clinic on a Tuesday by 8 a.m. and get registered and then assessed at their first visit, which includes physical assessment by the medical doctor, and they then get a social assessment to see if they have a strong social and financial support. If a patient passes this assessment, then they are fit to be added to the waiting list, male and adult female list as well, and also a children list. Now, the male list is longer than the female list because males are always involved in many different accidents in general. So there's a waiting list. We also have a private room, but this room only has 2 beds for persons who are private, which is actually a paid facility, paid to a company that is called Surgix, who runs that room. So after being added to the waiting list, you are then called for admission when the person's name arises in the sequence of the list. So after being called for admission, the person or patient becomes admitted through the clinic again. And they receive physical therapy between 3 to 5 times per week, including hydrotherapy, which basically is getting therapy within the water. You'll be very surprised what you can do in water as opposed to on land. You know that you can lift almost anybody in water. Did you know that? But you can't lift the person on land because of the properties of water, the buoyancy of same. Now, doing therapy in water can also strengthen your legs. That's why swimming is a very important aspect of rehabilitation. If you can't swim, you're still placed in the water and you are assisted in doing different motions within the water. Now, I mentioned before that patients are admitted between 2 to 6 months, depending on the level of their injury, and they are assessed during their admission there to see their progress. We also have something that is called a family conference held each, like every 4 weeks after a person becomes admitted. Now, in the family conference, what happens in the family conference? This is where the team comes together. The doctor, nurse, physical therapist, counseling psychologist, and the social worker also discusses the patient's progress with the family members and the way forward for the patient. So you know what's happening with your relative when you come to the facility, and you know what's happening regarding the patient's progress, right? We normally have a speech therapist, but we don't have that person again. She's now gone back to Germany. She was a person who had volunteered, but she was an elderly lady, and you know that during COVID time, elderly persons could not come out. From there on, she just went back. But there are only 4 certified speech therapists right now in Jamaica. 4. So when persons have stroke and they have difficulty in speaking or can't recall or can't speak, it's best that they are seen by a speech therapist to stimulate them, which will one help them with their speech, to help them to remember things, and in so doing be able to speak again. Because in doing so, communication can be can actually return. Speech therapy can be quite expensive. It can cost about what? About $10,000, $11,000 per session or so. So it all depends on same. So sometimes there are different factors that can inhibit some persons. So the aim of rehabilitation is for each patient to live as functional as possible based on what their body can do, that is based on muscle and nerve function. Now, is there an agency available to assist persons with disability? There is or there isn't? There is. Okay. So what is the name of this company? Oh, okay, they said it this morning. Wonderful, wonderful, wonderful. So the Jamaica Council for Persons with Disabilities assist with finding employment for persons with disabilities through their job placement officers. They provide rehabilitation grants for income generating projects. So within our family conferences, the social worker explains all these benefits that comes through the council. Now, if a person is disabled, they can register with the council. They get an ID, which can help them to, when they go on the bus, they pay a very small fee for the bus fare. This ID can also help them, of course, to apply for grants once they're on the system registered, so they can begin a business. So they can even, like, sometimes some persons maybe start raising chickens or doing whatever and turn around the money. If you are disabled person who is registered regarding getting a house from NHT, you don't have to pay any interest at all on your mortgage. So 0% interest on your mortgage. So that is actually a good thing. Not saying that you must get disabled now to get on 0%. But there are facilities which also help with accessing different allocations and housing solutions, which I mentioned before from National Housing Trust. Also, income tax. So you don't have to pay income tax as well if you're also disabled. So there are several different things regarding this. So there should be a holistic approach, which is a multidisciplinary approach in the key management of disabilities, which includes incorporating the medical, social, physical, psychosocial, and spiritual aspects of a person. Because without God, we are nothing, right? So we need to incorporate Him within all things. So some tips for communication. Listen to this carefully. Now, in all cases, face the person and address them, even if they are accompanied and communication is through someone else. This is about persons in general now who have disabilities. How should you communicate with them? With a person with a physical disability, comply with accessibility standards. Get down to their level to have a conversation. If the person you are talking to finds standing and or carrying a load difficult, offer to help. With a person with a hearing impairment, look the person in the face and talk to the person, not the interpreter. Always place yourself in front of the person when speaking to them, as many people with hearing difficulties lip read. Speak clearly, articulate without exaggeration, in a normal tone and at a normal, moderate pace. Keep sentences simple, short, and rephrase if they don't understand. Use the written word if necessary. Take minutes and provide hard copies of documents at meetings. Now, with a visually impaired person, the person does not necessarily know that you are talking to them because what? They can't see you, right? So don't hesitate to let them know you are there and who you are. So you introduce yourself to a person who is blind or who is visually impaired, as we would say, right? Offer the person your arm to guide them, but don't be offended if they turn down your offer. You got that? Okay. Check the accessibility of IT tools. Don't shout. The person may not be able to see, but they can hear you. It's not because somebody is blind that means they're deaf. Good? With a person with a learning disability, take time to listen and understand. Speak to the person even if it is their carer who is helping with communication. Do not be impatient. A friendly expression will give the person you are talking to confidence. Speak normally, using simple sentences and avoiding details. Encourage the person to express their own opinions. Do not hesitate to repeat yourself and make sure the person has understood your message by getting them to rephrase it. And I leave with you these two quotes. First one is written by Robert Hensel. It says, "There is no greater disability in society than the inability to see a person as more." There is no greater disability in society than the inability to see a person as more than they are, right? This one is written by Jordan Christian. "People with disabilities do not need to be fixed. They need to be accepted for who they are." Thank you. Are there any questions? Going once? Yes, Jody. Okay, her question is, how do we deal with persons that have invisible disability? So, as I mentioned before, there are many invisible disabilities. So, you can't know their invisible disability unless you have found out about it, right? So that means no, it now becomes visible to you. Maybe not visually like seeing them doing something, like seeing a physical disability. But for example, because remember that persons who have diabetes, it can cause them to have sensation issues, right? There are some persons who have learning disabilities. Yes, persons also who have sickle cell, right? Sorry, I drew the razor. Right. So that's the thing again. So somebody will not know that you have sickle cell unless you tell them. Yes. So for example, if you're at a function and the place gets very, very cold and your joints start hurting you, and the person beside you is actually wondering why you're crying for pain, why everybody's around you is quite fine. No, when you tell the person that you have sickle cell, if they know what it is, then they would understand what it is. Or it's about the person who has this invisible disability. Once you as a person realize this, because for example, there are some persons who might be bipolar, for argument's sake, which is a disability. Now, bipolar persons are very, very brilliant, but for some reason, something can trigger them off, and they just snap in the instant, and the person is a different person than you know them. No, you now realize that this person has something else, but you don't know what it is. Yes? Or you may see somebody on the road and you're talking to the person, and the person is mentally ill, and you didn't know that. And all of a sudden, the person snaps at you. Yeah? For example, there was a taximan that was calling. Somebody told me this. I'm sorry. The taximan calling in Harper Tree. Said that he's going or wherever he's going. And there's a madman passing, holding up on his pants, walking past him. As you guys would call him a mentally ill person. And he was passing the taxi, and he looked at the taximan and say, "You see me, I'm going away?" Yeah, I mean, this guy, he's mentally ill, but he understands what is happening, and he still responds towards him. So despite him being mentally ill, he said that he's not going anywhere. Had he been dressed differently, and he said that to the taximan wouldn't have known that he's mentally ill unless he did something more to that extent. So it's about finding out, because if something is invisible, you're not going to see it, but some things can trigger it off to bring it out in the person. Yes. Follow-up question. Yes. Okay. All right. So the Jamaica Council for Persons with Disabilities assists persons with visible disabilities. So it's most times spinal cord injury patients, stroke patients, persons with hearing issues as well. Yeah. So it's, and also those, they also help persons with some cognitive issues as well, but not all invisible disabilities. Yes. Any other question? Going once, going twice. Right, that's a very, very good question. So you're the second person who has asked me this question at a different location. So what happens? So muscle spasms is basically where your muscle fibers literally start twitching at rapid state due to the. Okay, so remember when I showed you the spinal bones, right? Now your spinal bones have spinal cords which actually runs through same, and nerve fibers which actually comes through same. Now, when you have a spinal cord injury or even an injury to an area, the muscles can end up into spasm and start firing. Now, spasms, perfect example, you meet into a car accident today. You're not in any pain today. But I kid you not, by tomorrow morning, you're going to start having pain. And by midday, the pain gets worse. That pain is actually caused by muscle spasms. Now, spasms cause pain and pain cause spasms. So the spasm is basically the muscle fibers, the nerves start twitching, which actually leads to pain. Now, how is this corrected? We get pain medications and muscle relaxants. Once the muscle become relaxed, the spasms go away. Right. So due to the injury, spinal cord injury or trauma. Yes. All right. Good. That's it. I hope we all learned something. Thank you.
Okay, happy Sabbath again. Thank you, Dr. Wilson. From myself, the Special Needs Director, and my team. Thank you for not hesitating to rise to the call. Or has it been from morning until now? Amen. Indeed, it has been. And Dr. Wilson came and enlightened, educated us as to how to care for persons with certain types of disability, especially persons that are bedridden, because oftentimes when we hear disability, we think of persons in wheelchair or so forth and so on. So to put the icing on the cake as we close off of this segment, we have some brochures here to hand out, and it includes some care that Dr. Wilson mentioned. So I hope you will find it useful. I need an assistant. Jason, you take this side. All right. So thanks again. God bless you. And remember that we are to be our brother's keeper. So look out for each other. And if you know of persons that you know has a disability, I was talking to somebody today, and you know where you can send them to get help, don't hesitate to do so. If your neighbor, someone in your community, sometimes these persons are often left alone, and so we have to be there for them. So as a church, as best as possible, let us try and reach out to these persons. All right. And I hope what happened today will not end here, but we will continue as a church to do what we have to do. All right. Until God bless you all, and thanks again.
Before that's it for the day. Stand up. Before the possibilities, director and assistant, elder in charge leaves the scene, I just want to personally say thanks to them for the effort that they would have put into producing today's program. and the insistence behind the scene that they would have needed to get this done. Coming right off the heels of a high time in the series, I think it was a fitting production, if I should put it that way. And I have no doubt that the Lord blessed your efforts, because today, so far, it has been a spirit-filled day. But I stand here because I want to just throw out a challenge to all of you who are here now. Because Goldsmith Villa Church is uniquely and strategically placed. And I want you to use today as a launching pad for the emphasis on the possibilities ministry. And why I say that is Sir John Golding is right up here, and I consider it in our territory. Cheshire Village is right there, and I consider it in our territory. Some people will say it's on the border. But I would want us to claim Cheshire Village and Sir John Golding Rehab Center and make and develop a project of adopting those two places. And so Goldsmith Villa Seventh-day Adventist Church can actually work towards becoming the location to facilitate people with the possibilities people, especially in those areas. And as we look at our development as a church moving forward, that we think of them as part of our congregation. So I am throwing out that challenge. We have a flyer in our hands. We got some information today as to how access can be had for these people. Think about it, because I am sure as a body we're going to be called upon to step up a little higher as it relates to relating to these people. Thank you so much, and thank you, and may God continue to bless the ministry.
Thank you, Elder. Thank you. And funny, he would say that, quickly, what I want to do, because we have to bring church to them. And so at least, I'm saying it even before I take it back to the board, at least once per quarter, I'm hoping that we'll be able to go to Sir John Golding. I will find out what the protocols are, and also Cheshire Village, that's the name, so we can bring church to them. Because indeed, we're given a commission to go ye therefore and teach and preach. They are not able to come, so as best as possible. So put yourselves in that frame of mind. Until we speak again on that matter, that is what we intend to do as a team. All right? God bless.